Hello, Calaveras County. Welcome to another edition of Mondo Calaveras. I'm your host, Mike Taylor. Well, we're coming into summertime, folks, and if you missed it, we got darn near close to 100 degrees just in the past couple of days as we've been taping today's show. And we couldn't think of a better guest to have than Dr. Dean Kelaita, the Calaveras County Public Health Officer. Dr. Kelaita, thanks for being here.
Thank you for inviting me, Mike.
You bet. And Dr. Kelaita, what exactly is a public health officer?
Every county in California has a doctor who oversees the health department and what's known as the public health system. Most people are familiar with their private doctor or their private source of medical care. You go to the doctor, you get a prescription, you get a test, that kind of thing. But the public health system, as the public health officer, my patient is the community or a population of people. So the public health system is involved in disease control, preventing the transmission of disease, preventing chronic illnesses, disease prevention, and improving the health of the entire community.
Okay. And that's statewide, so there's lots of you.
Right. Well, every county and 3 cities have health officers.
Oh,
too.
really? Oh, like
Yes.
San Francisco?
Berkeley, Pasadena.
Oh, wow.
And one other. So
Didn't
there's
have
3.
to be a trick question. Yeah. Okay. And so perfect timing coming here as we hit our first really hot spell of the year. Summertime seems to be something that has sneaked up on us the past few years, and all of a sudden it gets really hot. What do we do to get ready for that? What do you do when it's that hot outside?
There are a couple of different health problems that can be more common in the hotter or warmer times of the year. Just in general, there's heat-related illness. Heat-related illness is what happens when the body's exposed to excessive heat, especially if we're exerting ourselves a lot, working hard outdoors. We can get heat exhaustion. We can get heat stroke, which is a medical emergency. That's when the core body temperature increases to the point where it starts to put stress on the brain and on the nervous system. So there's things people can do to prevent heat-related illness. Obviously staying hydrated, drinking plenty of water, dressing appropriately with lighter types of clothing, making sure you're wearing sunscreen to protect the skin from sunburn, and trying to avoid excess activities at the time of the day when it's the hottest. So heat-related illness in general is that spectrum of problems that can occur that are related to the heat, anywhere from heat exhaustion all the way up to heat stroke.
And just to back up into I'll start with the first part, which I'm feeling would be the sunscreen, and then we'll get into the more serious heat-related illnesses. But sunscreen, for a while there was just sort of 1 or 2 SPFs, and now it seems like there's an SPF all the way from 1 to 50, and I think there's some 70s out there now. What is the recommended level of that protection that we should be using?
That SPF, solar protection factor, sun protection factor, that SPF is a rating of how long you can be in the sun when you've got that sunscreen on. So at a certain point it becomes a little meaningless because there's only so many hours in the day.
I was going to say, now 70 sounds kind of silly.
And so, the recommendation is SPF 15, or higher would be a good sunscreen. If you have kids, you have to make sure that you reapply the sunscreen if they're swimming, if they're spending a lot of time in the water, because even the sport sunscreens, the kind that are supposed to stay on your body for longer, those can still wash off after a certain time, especially if the kids are thrashing around a lot in the water, in the pool, at the lake. So just making sure that kids get SPF 15 or higher and reapply if they're going to be in the sun, in the water for prolonged periods.
And does it come off or sort of fade away as we perspire too?
To some degree, yeah.
Okay.
To some
I'm just
degree.
wondering, since a lot of us are out, getting that last weed eating done before everything turns brown.
And sun exposure to the skin can cause damage.
Oh,
and
yeah.
sun-related damage to the skin leads to certain types of skin conditions, actinic keratosis, precancerous skin changes, and that can lead to skin cancer.
Yeah.
So sunscreen can not only prevent sunburn and make you avoid an undesirable burn,
Yeah.
but it can also reduce your risk of skin cancers, melanoma, squamous cell skin cancers, basal cell skin cancers, those kinds of things.
Okay. And so we've got the sunscreen on, and now we have to worry about staying hydrated. And that does mean drinking water, not most of the other products that are out there marketed to us as something to drink when we're thirsty, right?
So, some liquids, can be, a little bit self-defeating. Alcohol, can be a little bit dehydrating, as well as maybe impair your judgment and decision making when it comes to keeping yourself safe. So avoiding alcohol when people are in the sun is a good idea. And then just good old-fashioned water. Be surprised. I see patients in my office, in my clinic every day, and I'm surprised sometimes by how little water people drink. I had one guy tell me, he says, well, I haven't drank water in years. I say, well, you mean you just don't drink it much? He says, no, I drink coffee, I drink, maybe a beer in the afternoon, maybe some iced tea, but I haven't drank water in years. So you consider it a medicine. People say, how much water, right, should I drink? It depends on the environmental conditions. But, at least 6 good 8-ounce glasses of water a day is a good goal for most people.
And so then do you supplement that if you're out exerting yourself, like weed eating out in the yard and it's getting warm at about 11 o'clock in the morning?
One way to tell, if you're hydrated is, when, urinating, if you can see that the urine is a, clearish color, that means that you're well hydrated.
Okay.
If it were to become very dark and orange and concentrated, then you know that you need to increase your state of hydration.
Okay.
That's a quick and cheap way to tell.
the one that avoids the call to the medical provider.
Yes.
Now, the next step to that, though, heat exhaustion, that's the emergency.
Well, heat stroke is more of an emergency. So heat exhaustion, let's say it's 104, you're out in the middle of the day and you're digging a trench. And as you dig, as you sweat, your body will become dehydrated, your muscles will start to cramp, you'll start to become fatigued, you might have double vision, you might have headache, and you need to rest and get into a cooler place. That would be heat exhaustion, that overwhelming feeling of tiredness and fatigue that sets in with severe exertion and dehydration. Heat stroke is more of a medical emergency. That's when the body's internal temperature starts to rise.
Has gone up.
And the brain and the nervous system is very sensitive to the effects of increasing heat like that. And so if the body's internal core temperature starts to increase past 98.6, starts to go up to 99, 100, 101, and we're not sick, we're not running a fever, we're just, we're succumbing to the effects of the heat, and our body's natural cooling processes can't keep up, then that becomes a medical emergency. Symptoms of heat stroke are going to be mental confusion, headache, becoming lethargic, and that can even lead to death if people aren't cooled immediately.
Wow, okay. And here in Calaveras County, with everybody kind of so spread out, are there places, not everybody has an air conditioner at home. And personally, I'm against the swamp cooler because I don't want to add humidity, but where can folks go to cool off, like the senior centers and that kind of thing?
Yeah, those kinds of places. So community buildings, public offices, government center, businesses, those kind of public libraries.
I was going to say the county library branches.
The Calaveras Senior Center, those places, especially during a declared heat emergency that the public health department will declare, a heat emergency or issue a heat advisory at times if the conditions are right. And then those buildings will make an effort to stay open to the public even beyond their normal hours during those times.
Okay. Now, so we've kind of dealt with the heat. What else happens in summertime? It generally seems like we feel healthier in the summertime. We're not fighting the flu season. We're not feeling like we're getting colds and the sniffles, that kind of thing, although sometimes those will go around. So what kinds of things happen to the public health system in the summertime?
Well, people become more active and there's more outdoor activity. There's certain types of illnesses that can become more common during the summer, especially things like mosquito-borne illnesses. And as we get into the spring and there's a lot of standing water, before we get into the dead of summer, mosquito activity increases. And when mosquito activity increases, then there are mosquito-borne illnesses. For example, West Nile virus, where we live, is the most common. In other parts of the world, there are other mosquito-borne illnesses like dengue fever, malaria, those kinds of things. But here where we live in the foothills and in California, it's West Nile virus. And West Nile virus is an organism, it's a virus, and it's transmitted by mosquito bites. And it can cause, different types of illnesses. In most cases, 80% of cases, people who develop West Nile virus infection won't even know it. They will be what we call asymptomatic, so they won't feel any effects. That other 20%, though, can start to get some problems. Those problems can range from fever, headache, muscle aches, what are called myalgias, all the way even to death in some cases. In rare cases, less than 1% to 2% of cases of West Nile virus are going to be fatal. And those are usually in people who are at high risk of complications. That's older people, people with weak immune systems, maybe the very young, infants, that kind of thing. So the best thing with West Nile virus is to avoid mosquito bites. That's the best preventative message that we can give.
What's the best way to do that these days?
Preventing mosquito bites, we have a little mnemonic, I suppose you'd call it. It's the 4 Ds. And so you dress appropriately by wearing long sleeve shirts, long pants. You avoid times where being outside when mosquito activity is at its highest. That would be dawn and dusk, right? You wear DEET. DEET-containing repellent, DEET. That's the name of a long chemical, and that chemical is in most mosquito repellents, and you can even get pure DEET. And DEET is a mosquito repellent that's very effective at repelling mosquitoes, and also draining. So the last D is drain. So to drain standing water around one's home, because that's where mosquito breeding takes place. Mosquitoes lay eggs, and the larvae will grow and hatch in standing water, and then you've got mosquitoes. And mosquitoes don't travel very far from where they're born. And so if you eliminate standing water around your home, what might have collected from rain and kids' toys or planters, flower pots, old tires,
the spare tires,
that kind of stuff. So if you eliminate that standing water around your home, you get rid of a lot of the mosquito breeding habitat that a lot of us have and not even know it. So West Nile virus is another example of a summer or spring/summer, type of health problem that we like to give people information about and have them take those precautions to avoid getting it.
One thing that I haven't heard much about this year, and we're filming at the beginning of June, is rattlesnakes this year. Has there been much activity with them this year?
Rattlesnake activity is hard to measure because we don't get that reported to the public health department. But we do track bites from rattlesnakes, because when people have a rattlesnake bite, they'll typically present for medical care to the local hospital emergency room, and we can see how many doses of anti-venom have been given. So when rattlesnakes or other venomous snakes, mainly rattlesnakes where we live, pit vipers, when they bite you, they'll envenomate you in many cases, and they'll inject you with their venom. And they bite out of self-defense. So, avoiding rattlesnakes is
the best prevention.
The best thing. But, sometimes you might reach under something and you might get struck by a rattlesnake, even though you weren't bothering or molesting it in any way. So if you do get a rattlesnake bite, there's been all kinds of things that people would do in the past. You'd cut it between the bite marks with a knife. You'd suck the blood, containing the venom out. You'd put a tight tourniquet around a person's arm to the point where you're strangling the blood flow and circulation to the affected extremity, and you dilly-dally around doing those kinds of things. That's not effective. What you need to do is seek and access medical care as soon as possible. And what they'll do for you is they will give you anti-venom, which is a chemical that will neutralize the venom of the rattlesnake. So that's the best advice. Get to a hospital emergency room, and you'll get antivenom. Sometimes you may need to stay in the hospital, overnight or for several days, getting repeated doses of antivenom if we're not seeing the right response to it initially. If the swelling continues, if tissue damage continues at the site of the rattlesnake bite, you have to get repeated doses of antivenom.
Are rattlesnake bites kind of like bee stings with people? Some people are more susceptible to the venom?
Some people have more dramatic reactions to the rattlesnake bites, to the venom from the rattlesnake. It could be other factors involved in that. Depends on the size of the snake. You could get a larger dose of the rattlesnake venom from one bite to another, and that could explain a more dramatic reaction. And there is some individual variability in that. And not only does the rattlesnake bite cause tissue destruction, it can cause other effects in the body too. Bleeding, internal bleeding. It can cause something called platelets. Platelets are necessary for normal blood clotting. It can cause all kinds of hematologic or blood manifestations as well. So that's why people need to be monitored in a hospital pretty closely when they have a rattlesnake bite. It's a big deal.
And the thing to watch for in our area is rattlesnakes are around our reservoirs because of the rocky shoreline. I know New Maloney's is, folks who frequent that lake talk sometimes about right around the boat launches because of those big warm rocks nearby, the rattlesnakes kind of will be there and they will swim. And, rattlesnakes and other, creatures that can, pose, risks to our health are part of the environment. They're part of our natural ecosystem. And in many cases are our friends. With getting rid of, rodents and, other varmints and things like that. So definitely.
Rattlesnakes are our friends. They're part of our ecosystem, so we need to live with
Just
them.
a matter of listening for that sound.
Yes.
That incidentally doesn't sound anything like it does in the movies or TV shows.
But most of us who've heard a rattle of a rattlesnake know what it is.
Exactly,
and animals
what it is.
know very
They
innately
do.
that there's, that rattlesnake sounds mean trouble.
Now we've kind of got through the heat. Something that seems to happen around our lakes a lot, and we mention in the heat, don't drink alcohol, but the summer barbecue and that kind of stuff. Does that drinking of alcohol, does it make it hit your system quicker? Do people get dumber faster in the heat with alcohol? It just seems like, yes, we're drinking more, but it seems like the effects of the alcohol get pronounced more in the summer.
It can, depending on our general state of hydration. Alcohol is an interesting substance, right? I mean, in most types of drugs that we ingest, whether they're drugs of abuse or prescription drugs or over-the-counter drugs, we have receptors on our cells where the chemical attaches to, and it turns on the effect inside of our cell. So we only need very small amounts of it. So we have milligram quantities of certain things that we ingest to exert an effect. Alcohol we actually have to consume a lot of in gram quantities, and it changes the fluidity of the cell membranes of our nervous system. And so by doing that, it creates its effect in the brain. And so by doing that, it can also release a hormone that causes us to have a diuretic effect, and we lose fluids, and we can get more at risk for dehydration with alcohol intake. And when it's hot, the last thing we want to do is become more dehydrated. And so that's the concern of alcohol in the heat, is it can exacerbate dehydration and just lead to suboptimal decision making.
Yes, very much so. I've heard folks who go to some of the larger music festivals talk about you might have one adult beverage and then a bottle of water, and then maybe a beverage, and then a bottle of water or two, so that you're pacing yourself and you're keeping yourself hydrated.
That's a good rule of thumb. And it's also drinking over a long period of time, too. So, a few drinks over many hours is going to be a lot better than in a very short period of time.
Yeah. Now, what else affects public health in the summertime?
Well, there are some other specific summertime-related issues, and then there are some high-profile public health issues that are taking place year-round that I think would be of note. One thing that's been a very significant concern to Calaveras County and our public health system is the increase in vaccine-preventable diseases that we've been seeing.
Oh, we have here.
Yes.
Okay.
In March of this year, an adolescent girl from the Valley Springs area who was unvaccinated returned from an international flight overseas, flew into San Francisco International Airport, became sick, had a fever. It took a couple of days for her to wind up getting diagnosed. She developed a rash and was diagnosed with measles.
Oh, goodness.
And so there were a lot of people that had been exposed to her, some of which were not, vaccinated and were not immune and were non-immune themselves. So you can see the potential for an outbreak of measles in the community when we don't get good rates of vaccination. And in Calaveras County, we don't have good rates of vaccination.
Oh, we don't?
For example, I looked some of the most recent data in Calaveras County. There's 88.1% of kindergartners entering kindergarten in 2017, 2018, who had received all of their immunizations.
Okay.
So 88.1. That compares to the state average of 95.1.
Wow.
So you can see that we are, significantly lower. And you might think, well, 88, on a test. I mean, that's a high B.
That's right.
Right? So,
not against measles.
Right. But it's a big deal because once we start to see rates of vaccinations drop off, then we can lose what's called herd immunity. Herd immunity is, let's say you had a herd of cattle, 100 of them, and there was one in the very center that wasn't immune to a certain disease, that it's going to be protected by all the ones around it who are immune. So that's known as herd immunity.
Okay.
So if you get a drop-off in the rate of vaccinations, then you have an increase in people who are susceptible to a vaccine-preventable disease. Then once you get below 92, 90%, you start to become very at risk for outbreaks. And as most people would know, there's been outbreaks of measles throughout the United States and California. And here in Calaveras County, by having lower rates of vaccination, we're very much at risk for a similar type of outbreak. Not only measles, but other vaccine-preventable diseases. Polio, whooping cough or pertussis. We see outbreaks of some of these things. And we used to think that these diseases were diseases of the past. These diseases were gone, but they come back. And the only reason that we don't see them very often anymore is because there's vaccines that have been preventing them. And vaccinations are the best public health intervention in the last 100 years. And so it's important for the public to be aware of that and to be aware of what happens when we start to get lax and we start to see reduced rates of vaccination. We see increases in vaccine-preventable diseases, such as the measles case in Valley Springs just 3 months ago.
Was anyone else in her family or community infected, or did anybody else?
No, we and it's not because the public health system did such a great job. It's because we dodged a bullet, basically.
That's what it
so
kind of sounded
there were
like.
other people that were exposed to the child, both in the family and in the community, who were susceptible themselves, and they just by luck didn't get it. So we didn't have any what we call secondary cases of measles that were related to the original case. And again, I would like to take credit for that as the local health officer, but it was just by luck that we didn't see an outbreak in our community.
When it just dawned on me, I know, and I can't remember exactly which one did what, but I know I was vaccinated as a youngster. But as long as you got those vaccinations when you were a child, as adults, are we still considered protected?
It depends on the type of disease or the type of vaccine that we're talking about. For measles, the vaccine for that is the MMR. That stands for measles, mumps, rubella. So it's a 3-in-1 vaccine. So kids will usually get their first dose around 1 year of age, and then their second dose when they go to kindergarten, between the ages of 4 to 6 typically. So by having 2 doses of MMR, that'll give you lifelong immunity.
I see.
That. Other vaccines might need to be reboosted, later in life to maintain their effectiveness. But most vaccinations will have a long-lasting and, in many cases, permanent immunity that they create. And vaccines are safe. So that's a misconception that many people in the public have. Vaccines, along with any other medical intervention, can have a small risk of problems or complications associated with them. But when you compare the risk versus the benefits, vaccinations are the greatest public health intervention in the last generation. And we've been fortunate not to be able to see cases of polio where you develop paralysis.
And bodies are ravaged.
If some of your viewers are old enough to remember outbreaks of polio where public places, public pools and things like that needed to be closed, it was very devastating. Meningitis, varicella, whooping cough. These are very serious childhood diseases that have been, for the most part, a thing of the past. But if we don't continue to be vigilant about vaccinations, they'll be coming back, and they'll be coming back with a vengeance.
Does the public health department offer any immunizations, or are those obtained through the what I guess I would call the traditional healthcare system?
A combination. Most vaccines are administered through a person's regular source of medical care, through their medical home, private doctor, medical clinics, offices, that kind of thing. But the public health department also offers immunizations too. So if people have any questions, they can call our local health department, 754-6460 in San Andreas, and they can get information either on getting a vaccine at our health department or through their regular source of medical care.
Great. So I think we've almost covered it, Dr. Kelaita. We've got put on the sunscreen. We've got drink lots of water when you're going to be outside. And actually, we should all be drinking those 6 to 8 8-ounce glasses, and more if you're out there working hard in the sun. And keep an eye out for the snakes and the ticks. And make sure by the time the kids start school, they've been immunized. Dr. Dean Kelaita, thank you so much for being here.
My pleasure. Thank you for
inviting me. It's a pleasure having you. And until next time, ladies and gentlemen, I'm Mike Taylor. Enjoy.